fantastic experience. Lots of really interesting opportunities in North Cumbria, as well as some fantastic and supportive trainers. I've had the ability to extend my training, take on new or interesting roles and develop myself in ways I really never thought I'd be able to do so. The beauty of North Cumbria is that you're not treated as a number, you're treated as a person, and you're almost invested in.
When I experienced general practice, I just thought that's for me. It's very much about walking with people through their life journey, helping to support decisions to try and improve outcomes and experience, applying the science, but in a very personalised and holistic way.
The ethos in the practice is very good. So the senior partners here at Carlisle Healthcare are very driven towards education and fostering an environment where you don't feel out of place for asking questions. I think it's very important in the way that general practice is changing nowadays in terms of the models of provision of care. With the shortage of doctors and shortages of kind of more senior trained healthcare staff, we're looking at recruiting a lot of other auxiliary roles like assistant nurse practitioners, specialist nurse practitioners, to look at managing kind of longer term care, and also looking at how we structure the different delivery systems. So say having a head GP or a central senior figure managing a wider team. So that educational environment is very important for allowing people to come on board, feel part of the family, feel open to asking questions where they need, and just developing the learning process as they're actually on the job.
So training and support is a huge amount of what we do, and that's partly around building sustainability, building resilience. We've got a number of GP trainers within the practice. We regularly host GPs in training and have employed a number of GPs as they've come through training. We also support and train other health professionals.
The way we've approached that is to try to provide them with something that's outside of the practice. So although it's 4 at the moment, 2 of them are doing a job share, and they're doing part-time and half-time in hospital. So they're working in different hospital disciplines to bring up the skills on that side. One of them's working down the Glenridding practice down in Ullswater. So we've approached it as a way of giving more opportunity for the registrars to do something that's different, and that's something that, for example, the hospital work traditionally GPs wouldn't get to do until later in their career, and they decided they're desperately interested in, I don't know, dermatology or something, and want to go down that route. So it's given them a richer experience.
I think being a GP in North Cumbria affords you, if you would like to be part of, of the establishment, to take part in a number of roles, to be part of the GP community, but also to influence the health of the population.
I had a fantastic supportive trainer who would really flag up areas I need to improve and do well, and I felt as I was developing as a GP. But beyond that, I wanted to do more to help, to be a real advocate for patients, and I raised an interest in leadership, and as a result I was given the opportunity of working within our local CCG and observing some of the meetings, having my own mentors there, and learning an immense amount in that time. My rotations are very much balanced between both very much inner city urban to very remote, challenging rural environments, and the contrast really helped me with develop and both skills, but also appreciate the benefits and challenges of each.
Cumbria is great just because of the breadth of practice. Okay, so being a trainee, you get a lot of different variety. So you can work in a big city centre practice like I did, and then move over to say somewhere smaller like Keswick, which is a smaller rural practice. The populations are very different, and on each side of things in terms of looking at the logistics of healthcare, so kind of how do you get patients to hospital, how do you get medicines to the patient, and how you plan your day-to-day working around those kind of challenges, as well as the medicine. So kind of later on when you do develop a career and you kind of move to different areas, you're then well trained and well placed to be quite independent in the way you work. So that's one of the big advantages, I think, for working around here.
So my practice is very much within a inner city urban environment. well away from lakes and mountains and whatnot. And we've got our own challenges of pockets of deprivation, areas whereby we need to support people who haven't got the best of health. However, having the lakes on your doorstep is a real bonus, because actually, you know, after a busy week, I know I've got the weekend where I can go to the lakes, enjoy myself, and recharge, reset for the next week.
They're young, they're keen, they're enthusiastic, their knowledge is terrific. They bring a real injection of energy into the practice.
I love what kept me here, what kept me in Workington was that the people were so friendly, and that even, you know, sometimes, you know, you do have your challenges like everywhere else, but it, you know, at the end of the day, it does feel rewarding.
I felt very much part of the team, not just by my own practice, but by the local community.